Madam Secretary, thank you for being here today. The President, after the G7 summit this week, said the Affordable Care Act is working. I mean, part of what's bizarre about this whole thing is we haven't had a lot of conversation about the horrors of Obamacare because none of them come to pass. And he continued, somewhat oblivious seemingly to some of the things I'm hearing in my own district, saying, quote, it hasn't had an adverse effect on people who already had health insurance. You know, I'm frustrated, and I know many Hoosiers are frustrated by some of the adverse impacts that they've experienced, from diminished coverage options to lack of accessibility in their own communities for care. A lot of people are being squeezed when they go into the exchanges with price increases on premiums. And then there are the penalties, of course, the mandate taxes that exist if they can't afford to buy health insurance. And so I just want to humanize this a little bit for you because I know you're quite conversant in the statistics and the goings-on of much of this healthcare law. Patsy, from my district in Jeffersonville, Indiana, her premium went up $135 a month. She no longer has access to the family physician that has cared for her for over 25 years. Brandon from Greenville signed up for health care his family can't use because his family's deductibles are too high, and they make just enough that they don't qualify for assistance. Jason from Georgetown, Indiana, had to seriously consider paying the individual mandate tax because he couldn't afford to pay the increased premiums on the exchange and didn't qualify for an exemption. Deborah from New Albany's monthly premium skyrocketed to $800 a month, more than her mortgage payment. So these are just illustrative of what are larger problems in every state across the country, every congressional district. And, you know, to use the President's own words, these horror stories haven't come to pass. They are coming to pass. They're in existence right now. And I just want to know what you believe, Madam Secretary, I should tell my constituents who are trying to comply with this law. Are they merely collateral damage?
So with regard to the examples and stories, I think they are important, and they are important to combine with the numbers in terms of what we know that 16.4 million people in our country are no longer uninsured. And the stories, I hear those stories and respect those stories, but having traveled 22,000 miles and been out, I heard the story from the woman in Texas who said, you want to know how to treat MS? I'll tell you how to treat MS. You get sick enough to go to the emergency room and they'll treat you. And now she said, I will know how.
So in the near term, what do we do? I'm sorry for interjecting, but time is short.
Yes.
What do we do for these Hoosiers who don't qualify for a hardship exemption?
So I think, first of all, we need to make sure, have they exhausted that remedy? And please, work with us on that.
I've made sure they have. Our office has.
Thank you. And have worked through us. The other thing, on a number of the examples that you talked about, there is the issue of coverage to care and helping people understand how to select the right plans. The plans on the marketplace are very varied. There are many in terms of the questions of deductibility and that sort of thing.
Thank you. Mr. Renacci.
Thank you.